Good morning and welcome to our virtual prosection for Group 4. We are doing the major vessels dissection, and the people that have covered this wonderful presentation are Kendall Cross, Anna Kemp, Morgan Mars, and I'm Emma Starcher, and we will be starting off this with just a sweet little description of our goals for this prosection. So our goals for this dissection are obviously for us to get a good understanding of the major vessels of the thorax, upper limb, and the lower limb, and to understand the blood flow throughout the body in those areas. But we also want you to be able to understand how that all works together with muscles and how the cat and the human relate to one another and how similar they are and what the differences are. And so hopefully this will help us with our upcoming practicals and other exams and quizzes and whatnot, and just give us a better and fuller understanding of anatomy in general. So what are the major vessels? Well, obviously all of y'all can read, so I'm not going to read all of those out, but this is just a short list. If you get lost and if you want to be able to see all of them condensed, you can refer back to this slide. Okay, types of vessels. This is the first kind of more dense topic that I will be covering. Basically, you have two different types of vessels that we will be talking about. We have arteries and veins, and most of y'all probably know this just from general anatomies and other classes and stuff. But just to review, arteries take generally oxygenated blood away from the heart, AA, that's why I have those two highlighted in red, and they both start with A, so that's just really helpful. And then they're usually depicted in the color red in diagrams and pictures, just so you know what you're looking at. And then veins usually take deoxygenated blood toward the heart, and they're usually depicted in the color blue in diagrams and pictures, and even in the cadavers that we have, sometimes they're dyed that color. But also we want to be aware that pulmonary arteries and veins are the opposite. They are the opposite, everybody. So don't get too wrapped up in the fact that arteries always take oxygenated blood away from the heart. For pulmonary arteries, it takes deoxygenated blood away from the heart to the lungs, and then pulmonary veins take oxygenated blood back to the heart. So lastly, for this introduction section to our presentation, we just wanted to go over what you would do if you were to actually able to dissect this in real life, since sadly we are not in person and able to do this in an actual lab. We wanted to give you some helpful tips that we found through research and through reading the lab manual and other people's previous presentations and all the things on the internet and whatever. So first, just remove as much fat and connective tissue as possible using scissors. We read that if it is too dense or too tough to cut, that you can massage it and that it will loosen up and be easier to cut. Also, you need to remove the pericardial sac. It's a hard word. Pericardial sac, but do not remove its contents. That might be difficult, so maybe look up some YouTube videos and things that could help you with that. Dissect the veins first, as they are just closer to the front than the arteries are. And then you can cut the veins afterward and reflect them to be able to see the arteries better. Then use a probe to keep yourself from cutting anything out accidentally when you're identifying structures. And then start all of your incisions towards the head and move towards the tail in your cat, just to, I guess, keep things uniform and to hopefully not break any structures that you're not supposed to break.
We're going to start by looking at the vessels of the thorax. In order to get to these vessels in the thoracic cavity, you're going to have to cut through the muscles of the thoracic wall, and you're going to have to get through the ribs. So you're going to want to break them at about the midway point between the sternum and the vertebral column so that you can pull them back in order to have access to the thoracic cavity. Within these, you're going to have arteries and veins, but you're going to have to reflect the veins in order to get to the arteries because the arteries are posterior to the veins within the cavity. The first vein that we're going to be looking at is the superior vena cava. The superior vena cava is a major vein that brings deoxygenated blood back to the heart. When the blood leaves the superior vena cava, it enters the right atrium of the heart in order to restart the process of becoming oxygenated and sent back throughout the body through the aorta, which we'll talk about later. Due to this vein being an entrance point back into the heart, there's quite a bit of branching going into this vein. The left and right external jugular veins come together with the two subclavian veins before the superior vena cava sends the blood back into the heart. These veins are contributing to the superior vena cava because it is bringing blood back to the heart from the head, neck, and upper limbs. Within the image, you will also notice the transverse jugular vein and left internal mammary vein has been labeled. Both of these veins are within the thoracic cavity. The internal mammary vein, also called the internal thoracic vein, contributes to the superior vena cava as well. Here you see a picture of the superior vena cava from complete anatomy. Notice how there is branching going into the superior vena cava before entering the heart, and the size of this vein due to it bringing back all the blood from the head, neck, and upper limbs in order to become oxygenated. The pulmonary trunk is an artery that divides into left and right branches after it exits the right ventricle. This is the only artery carrying deoxygenated blood because it is carrying the blood to the lungs in order to become oxygenated. As you can see in the graphic below the writing on the slide, there's a small structure that is hard to be seen on cats connecting the pulmonary trunk to the aorta. This connective structure is called ligamentum arteriosum. This structure is useful within the womb to prevent blood from the pulmonary arteries to the aorta, preventing blood circulation throughout the lungs. The aorta is the large artery that will send blood throughout the entire body from the heart. When the blood is forcefully pushed out of the heart because of the left ventricle, it enters the aorta where it will be distributed to the rest of the body. There's a curved portion of the aorta called the arch of aorta, which we will talk about next. The beginning and ending of the arch of aorta can be found at the level of the sternal angle and the T4 vertebra. If we were dissecting in lab, you would notice that it curves dorsally before bifurcating into the brachiocephalic trunk and left subclavian artery. The aortic arch within the cat represents a cow aorta more so than a human aorta. This is called a bovine aortic arch. Next, we're going to look at the brachiocephalic trunk. This trunk gives rise to three branches: the right subclavian artery and the left and right common carotid arteries. If you look at the images, you will notice that all of these arteries are cranial to the heart and are red in color since they carry oxygenated blood. As stated earlier, the internal thoracic arteries can also be called the internal mammary arteries. They are each a branch of their respective subclavian arteries and supply the thoracic body wall by dividing into smaller branches, the intercostal arteries. The intercostal arteries are located between the ribs and supply blood to this area. Next is the vertebral artery. This artery is yet another branch of the subclavian artery. When dissecting this artery, you would notice that it travels dorsally and medially. If you do ever get a chance to dissect this artery in lab, make sure to be very careful when doing so because it is a very small vessel. This artery travels through the transverse foramina in the cervical vertebra as well. The thyrocervical artery is once again another branch of the subclavian artery. It travels cranially, so the shoulder area receives oxygen through the blood supplied to it from this artery. As you may have noticed by now, there's a whole lot of branching within arteries and veins throughout the body. The final vein within the thoracic cavity that we are going to talk about is the azygous vein. This vein can be found in the posterior portion of the thoracic region. In order to get to this vein within a dissection, you will need to roll the organs from right to left in the anatomical position. This vein is found only in the right side of the region, so make sure that that is the side you are looking in if you get the chance to dissect. Do not get confused during a dissection by looking for this vein on the left side. This is the final vessel for the thoracic region that we will be discussing. Next, we will talk about the vessels in the upper limb.
We will now move from talking about the thoracic vessels to talking about the vessels of the upper limb. This slide shows an overview of the upper limb arteries. We begin with the subclavian artery, which is part of the thoracic arteries. That continues on to form the axillary artery. Part of the axillary artery branches off to form the subscapular artery, and the rest continues on to form the brachial artery. The brachial artery later branches off to form the radial artery and the ulnar artery. Here we can see the axillary artery in the cat. If you look, you can see the subclavian artery, which continues on to become the axillary artery at the lateral border of the first rib. You can identify this artery because it's very large and it is among the cords of the brachial plexus. The axillary artery branches off into several different arteries, but the largest branch is the subscapular artery, and that travels dorsally to the shoulder and supplies a lot of the muscles of the shoulder. We just looked at the axillary artery, and now we see the brachial artery. The axillary artery becomes the brachial artery at the inferior border of the teres major muscle, and the brachial artery supplies most of the muscles of the arm. But once the brachial artery runs through the cubital fossa, it then branches into two other arteries, the ulnar artery and the radial artery. Now that we've talked about the arteries of the upper limb, we can talk about the veins of the upper limb. We begin with the radial vein and the ulnar vein, which drain the blood from the forearm. Those drain into the brachial vein, which drains into the axillary vein. The cephalic vein contributes to the axillary vein, and then the axillary vein drains into the subclavian vein. Now we can take a closer look at the axillary vein and the brachial vein. The brachial vein drains most of the blood from the upper limb and then drains into the axillary vein. The last vein we'll look at in the upper limb is the cephalic vein. This vein is easy to identify because it's very superficial on the posterior shoulder. It drains the blood from the dorsal shoulder and then drains into the axillary vein near the clavicle. We've now looked at all of the vessels of the upper limb. So let's now look and see how these vessels connect with the landmarks we've learned in lecture. Remember learning about the brachial plexus? The axillary artery is located among the cords of the brachial plexus, which is in the posterior triangle of the neck. Here we see the teres major muscle isolated. The inferior border of this muscle is where the axillary artery becomes the brachial artery. As we follow the path of the brachial artery, we see that it runs through the cubital fossa. Remember that the contents of the cubital fossa from lateral to medial are the tendon of the biceps brachii, the brachial artery, and the median nerve. After running through the cubital fossa, the brachial artery turns into the ulnar artery and the radial artery. The radial artery runs through another landmark that we already know, which is the anatomical snuff box.
Now we are going to be talking about the vessels of the lower limb. First, we are going to be talking about the femoral artery, which is located in the femoral triangle and is the major artery of the lower limb. The abdominal aorta divides into the common iliac arteries, which then divide into the external and internal iliacs. As the external iliac artery goes under the inguinal ligament, it becomes the femoral artery. The femoral triangle, which contains the femoral artery, the femoral nerve, and the femoral vein, has three borders, which are sartorius, adductor longus, and the inguinal ligament. The picture on the right shows the femoral artery on the anterior thigh of the cat. At the knee, the femoral artery gives rise to the saphenous artery, which runs medially on the thigh. There's not much to say about this artery other than the fact that it runs between the sartorius and gracilis muscles accompanied by the saphenous nerve. The popliteal artery is a continuation of the femoral artery. The popliteal fossa, which is the area in the back of the knee, contains the popliteal artery, which runs between the two heads of the gastrocnemius and branches into the posterior and anterior tibial artery. The image on the right shows the popliteal artery, which is deep in the posterior knee. Also, this artery is clinically relevant because if a person fractures their knee or tears a knee ligament, this artery can rupture and cause massive blood loss, which can result in death if untreated. The anterior and posterior tibial arteries are continuations of the popliteal artery. The anterior tibial artery is located on the anterior compartment of the leg and supplies blood to it, while the posterior tibial artery is located on the posterior compartment of the leg and supplies blood to it. The anterior tibial artery becomes the dorsalis pedis artery at the level of the ankle joint, which is an overall important artery in the blood supply to the foot. Also, the deep fibular nerve runs alongside the anterior tibial artery, while the tibial nerve runs alongside the posterior tibial artery. In lab, the veins of the lower limb that we will be dissecting are the femoral vein and the saphenous vein. The femoral vein is a deep vein that is found in the femoral triangle. It arises from the external iliac vein. In the picture, you can see that the femoral vein is located deep within the anterior thigh of the cat. The saphenous vein is a superficial vein, which is located on the medial aspect of the thigh and the leg, and it drains into the femoral vein. The picture shows that the saphenous vein is medial on the thigh and is closer to the knee joint. The saphenous vein carries blood from the lower limb to the femoral vein, while the femoral vein carries the blood back to the heart from the lower extremities.
Yay, y'all made it to the end of our presentation. This is Emma again, and I'm just here to do a review quiz with y'all. So after I present a question, y'all should pause the video, come up with an answer, and then if you press play, you will see the answer revealed. And if it needs more explanation, then I will also do that. Okay, so first question, true or false? Arteries take blood away from the heart. So this question is false because in the pulmonary arteries, you are taking deoxygenated blood away from the heart to the lungs to get oxygenated. So even though most arteries in the body do take oxygenated blood away from the heart to the body, that is not the case for pulmonary arteries. So just be aware of that. Question 2, which vein does not contribute to the superior vena cava? Okay, the answer to question 2 is B, the cephalic vein, because the cephalic vein is its own vessel that runs along the shoulder region of the cat. It is not connected to the superior vena cava at all. Question 3, at what level does the aorta start at, and what level does it pierce the diaphragm to enter the abdominal cavity? So you should be coming up with 2 different answers for this question. Okay, so the answers to this question is the level of T4 and T12. So even though the aorta goes higher than T4, it starts there. So you just have to be aware of that even though it does go higher, that it starts there. And then T12 is just where the level of the diaphragm is, so that one's pretty straightforward. Question 4, the axillary artery becomes the blank artery. The answer to question 4 is that the axillary artery becomes the brachial artery. This happens when the axillary artery arrives to the inferior border of the teres major muscle, and it becomes the brachial artery at that point. Question 5, the cephalic vein drains into which vein? The answer is D, axillary vein. This one's just pretty much straightforward anatomy and memorization. Question 6, list the contents of the femoral triangle from medial to lateral. This is kind of a review from our previous test, but is still relevant. The answer is from medial to lateral, the femoral vein, femoral artery, and then femoral nerve. The quick little trick to remember this is the venous is next to the penis. Hopefully that helps you remember this. All right, question 7. If you were to sever the external iliac artery in an accident, what other structure would most likely be injured? So this one's a little bit tougher, but if you know the structure surrounding the external iliac artery, you would know that the inguinal ligament runs over it, and so if you were to injure the external iliac artery, you most likely also severed the inguinal ligament. Question 8. What artery or arteries does the femoral artery directly split into? A and D are the correct answers to this question, even though the posterior tibial artery and the anterior tibial artery do come from the femoral artery. They don't come directly. The popliteal artery splits into those 2 arteries listed, so that is why the answers are only A and D. Question 9, identify the structure. The answer is anterior tibial artery. This is a picture that just comes directly from a few slides ago, so if you need a refresher, just rewind and go back to that picture. Question 10, true or false? The saphenous vein drains into the femoral vein. The answer to this one is true. Not really a further explanation needed. Lastly, since we don't have the capability to give everybody handouts, like the past labs have done. This next slide will be some diagrams and pictures that you can screenshot on your own desktop to use as a review. Thank you for watching all of our presentation. Have a great day.